Is smoking a preventable risk factor?
Certainly. If you take a look at all comers on people that haven't smoked versus smoked, it gives you about a 50% increased risk to your first heart attack.
So what does smoking do to the heart? How does puffing a cigarette bother the vessels that supply the heart?
Yeah, there's lots of theories and mechanisms. First is it does cause a generalized inflammation in the body. So your vasculature, the blood flow to your body, has these walls that are lined with cells. Those cells get irritated, and when they get irritated, they become inflamed.
And when they become inflamed, does the nicotine or something in the cigarette make the blood vessel inflamed? And that is where the cholesterol is deposited?
Exactly, yeah.
Is that what happens there?
Cholesterol loves to go to inflamed plaques. Plaques that rupture and have exposure inside the vessel are all caused by inflammation as well. Cigarette smoking precipitates all of that.
How about if you're living in a house where somebody else is smoking and blowing secondhand smoke at you?
Yeah, certainly. Not quite as much as the inhalation you're on your own, but secondhand smoke probably gives you about a 10 to 15% risk of an event.
So it's a huge, huge problem. I see more and more people in East Tennessee and Knoxville not smoking as much as they did. Is it your feeling that people are smoking less, or you see all the people that a biased population that comes down and they smoke, they get a heart attack?
Exactly. I would say if there's one modifiable risk factor for what I see in people with early heart attacks, meaning people under the age of 40, it's cigarette smoking. It's very hard for patients until they have that event to really kind of quit.
How do you tell your patients to quit smoking?
Most of the time, if I see them in the setting of a heart attack, I'm hoping that's an event that makes them nervous enough to want to have good health habits. Secondarily, there are a lot of different medications. People have asked, have this new vapor cigarettes, do they help? The long and short of it is there's not a lot of data on any of it. It's kind of whatever works for you.